Welcome to Recovery with Root, a podcast centered on topics surrounding mental health and addiction. Through our Advanced Recovery Institute, a new entity of the Root Center for Advanced Recovery, we are committed to research and training to elevate clinical care. We hope you find this podcast informative, and most of all, we hope that it helps improve the lives of others. Remember, we're in this together, and recovery is possible. Welcome back to another episode of Recovery with Root. I'm Margot Farrell, the Chief of Staff here at the Root Center for Advanced Recovery, and I am joined by Dr. Vora, who is the Chief Medical Officer for the Mashantucket Pequot Tribal Nation. So thank you so much for joining us today, Dr. Vora. How are you?
Doing great. Thank you for having me, Margot, and congratulations to you and the entire Root team on many wonderful milestones recently.
Oh, thank you so much. Yes, a big milestone for us is our Pequot Health Partnership. So that went underway just a few months ago. Now you guys have us as your behavioral health provider of choice. So we are so honored to be in this partnership with you guys and trying to help as many people as possible.
Likewise, there's a big need as we know it. Certainly, as you live and breathe that experience in mental health, all of us need support at some point in our lives. And no community is immune to the impact of the life and its interplay on our health and well-being, including mental health. So we are appreciative of wonderful community-based partners such as Root Center for Advanced Recovery in being not just a clinical but also a strategic partner in how we look at mental health in its complete overview, and have more of a community-based approach to strengthening our mental well-being across Southeast Connecticut and beyond.
Absolutely. And a topic that, we're going to talk about today, you're very passionate about talking about sleep. We have you as a clinical grand round presenter in a few months, where anybody who's listening to this or watching this and may be interested in getting continuing education credits or learning a little bit more and diving deeper than what we're going to be talking about, that's in a few months. So we're really excited about that. But this podcast is really meant to be someplace that anybody and everybody can come to, right? Your mom, your neighbor, your cousin, anybody with an interest in mental health, overall health, addiction issues, anything like that, we're going to talk about. We know that sleep is obviously a huge predictor in the success of most of what we go on to do in life, whether it be mental, physical health, successful at Root, for me at work, and making sure that I can do all the things that I need to do. Sleep is kind of where it all begins. Tell us a little bit about where your passion starts with this and kind of where you think we should begin this conversation.
Certainly. So, as a way of background, my clinical background is in internal medicine, pulmonary diseases, which is mainly disorders of the lungs, which deals with air and oxygen. It also includes specialty of critical care medicine, where most of the individuals that I take care of are in the ICU on life support of different types. And then finally, my fourth specialty is sleep medicine. So as a board certified sleep physician, we are trained to look at not just the science of sleep and sleep medicine, but also its intersection with different specialties and different realms of our physical and mental emotional health. So as one of my mentor and famous author also had mentioned, if sleep did not really have a valuable role, then certainly evolution made a big mistake, because as you know it, we at least have 7 to 8 hours of our 24-hour cycle in a sleep rest state. And if that did not really have any function, if people look at sleep as essentially non-productive time where they could be doing something else, either work or a hobby, or perhaps scrolling on social media or binge watching that next hot season on Netflix or Amazon Prime or any of those channels, then certainly, that's a big evolutionary mistake. And that is not the case. So, Margot, in this podcast, I would love to just share with the audience, what is normal sleep, and then how is sleep linked with essentially all aspects of brain health and mental health function. So that's just the overview of things to come.
Yeah, I mean, we talk, sometimes you hear 7, 8 hours. I am someone, I will be first and foremost to say that I take my sleep very seriously. I just did the whole moving the phone out of the bedroom at night move, which is so much harder than you think it is, which it sounds sad. I get mad at myself when I realize how hard it is. But once you kind of develop a new sleep routine, you kind of realize like, wow, this makes a big difference. Like for me, all of a sudden, I realized just how often I was maybe going to reach for the phone at night, like, oh, can't sleep. I'm going to go scroll, or, oh, I want to look this up. And you just kind of realize that small things can really kind of lead to a big impact.
It sure does. Those are the keystone habits, right? So the keystone habit that you implemented is to not have the phone on the nightstand next to you. And that just one simple act reduces the easy access to, first of all, stimulation, which keeps the mind active when you're supposed to be unwinding. And secondly, the blue light. The light itself is a powerful stimulant to increase arousal and alertness and not promote sleep. So by keeping the physical device away from our nightstand, it reduces that temptation to either look at and scroll on phone before going to bed, or when we wake up once in a while to go to the bathroom or whatever reason when we turn, the urge to check the phone or the messages or notifications that many of us might leave on even during the sleep mode. So yes, those are the key foundational steps of sleep hygiene that as sleep physicians we always talk about with our patients around what constitutes good sleep hygiene. And that's, as the saying goes, only use the bed for sleep or sex, and not to have food in bed, not to have TV on all the time. Certainly, many of our community members are in the habit of having white noise or blurred TV as a distraction, uh, not very conducive to deep sleep. It leads to micro arousals. So, keeping the temperature of the bedroom at a comfortable level for you, certainly avoiding bedside phone, avoiding caffeine close to bedtime. Those are simple but powerful steps for sleep hygiene that can promote good sleep.
What are some telltale signs? So if somebody comes to see you, what are some just, you're talking about sleep hygiene. What are some signs that maybe folks are they're lacking somewhere in that sleep hygiene? What are some things that you as a physician, the bell goes off immediately, or you think to ask that people may not think of right off the bat?
Certainly, many patients who have multiple other medical conditions, right? None of us live in isolation. Oftentimes, people who live with diabetes also have depression, and they also report difficulty falling asleep or staying asleep. So just have to listen to the patient, give them time to tell their stories, and during the interview, specifically ask about their self reported quality of sleep and quantity of sleep. So, as a general rule of thumb, it's easy enough to ask the patient how they rate their own sleep. And, it's surprising the answers you get, right? Oftentimes, I would say on any given day, over 50% of the patients that I would see do report some issues with sleep. Either it's difficulty falling asleep or staying asleep or waking up too soon, too early. Some may report that their spouses are complaining about snoring or disrupted sleep where they actually wake themselves up, gasping for air. Oftentimes, patients report difficulty staying awake and alert in the daytime. So, increased daytime sleepiness is also a sign of something going on with poor sleep. But overall, as a nation and as a society, I think with the 24/7 cycle that we promote, the city that never sleeps, the slogans like that certainly seem to make sleep more, superfluous. And it's horrible because that disruption is creeping into younger and younger age, where even the middle schoolers and high schoolers have chronic sleep deprivation. Essentially, none of us are getting enough sleep as a society. Individually, if you ask, people, they may say they report 5, 6 hours. Some may report more, but the ideal sweet spot is to aim for somewhere between 7 to 8 hours for an adult. For younger kids, For adolescents, it's actually more. So sleep duration is one of the foundational key questions you would want to ask about. And then you would want to ask about sleep quality. So that's how I normally approach discussion about a member or individual or patient's own self-perceived sleep hygiene and sleep issues.
Well, you mentioned with the city that never sleeps and the, rise and grind and all that kind of stuff, all that's kind of ingrained into us about kind of our work ethics, that sometimes you're right, it does kind of get put in the same box of like, oh, well, if you give all this time to sleep, then you're not working hard enough in XYZ areas. But it's kind of counterintuitive, because really, if you don't have that good basis of sleep, then the level to which you're probably performing in other areas of your life, professional, athletic, whatever it may be, are probably not as strong, I would guess, as what they could be, even if you think you're maximizing the time because you're awake and you're doing something.
You bring up a great point, and I would say that sleep is a legal performance enhancing technique. It's not a PED, it's a PET, where essentially, as an elite Olympic athlete, you know better than anybody else. Sleep, certainly leading up to the major event, but certainly the night before the event, has so much powerful impact on physical conditioning, muscle responsiveness, certainly decisional capacity in terms of emotional regulations as well. All that changes when the night before the event or a major exam or a major job interview, if that night's sleep is disrupted and not as good as it should be, it can lead to suboptimal performance, which at a high level of performance, like at the Olympics or the MLB or NBA, or even at high school sports level, it matters. So I think for anyone interested in biohacking or in self improvement, performance improvement, sleep is the powerful ally. And I would urge the listeners to look at the not so new science around sleep as a performance enhancing state.
And it also, so we're talking like, you're talking about my athletic background there, or somebody who's coming into a job interview. So a lot of the patients that we're seeing at Root, they're struggling with a mental health issue or substance use, or maybe both. And you talk about maybe not being able to make the best judgments, like your emotional regulation and things like that. How can sleep play a factor when we take out, all the other things we've been talking about, but maybe when it comes to just prioritizing your own individual goals, when it comes to maybe helping your mental health? I'm sure there's probably a link there with anxiety and depression, or, your responsiveness to maybe, not use something to combat a type of sensation that you're feeling. I'm sure there's a lot of linking right there.
Absolutely. It cuts both ways. It's a bi-directional link between sleep disorders and mental disorders, meaning that oftentimes sleep disorders such as chronic sleep deprivation or acute long-term severe lack of sleep can affect mental condition. We all know that. We've seen that in our own personal lives and families and friends around us. Um, the key is to realize that sleep has such a powerful fundamental role in our neurotransmitter regulation that it affects the levels of neurotransmitters that you may be familiar with: serotonin, dopamine. And when those levels are off kilter, it leads to heightened levels of increased risk of feeling anxious, depressed, irritable, poor judgment, like you said, self control, impulsivity, those become an issue. And at times, it's also been linked with norepinephrine level. So when we are sleep deprived, the the adenosine level in our brain keeps going up. That induces more sleep pressure, but then it also leads to increased inflammation and cortisol level. So there's a strong interplay between neurotransmitters, stress hormone levels such as cortisol and epinephrine, also known as norepinephrine, noradrenaline. And the fascinating link is that between sleep and our gut microbiome. meaning people who are not treating their sleep with the same respect at maintaining consistency of sleep time and wake time, maintaining exposure to appropriate light at the right time of the day and night. That leads to a change in our garden of the bacteria in our gut. People know that as gut microbiome. And our listeners would be, interested in learning more about it. But certainly think about gut microbiome as a collection of a garden of bacteria, viruses, fungi, archaea that live within our intestinal digestive system. They live on our skin. They certainly live in our lung tissue inside as well. So, as much as we are antimicrobial culture, it is still, incredible that we don't realize how much we are dependent on the microbiome for our health and well-being. But there's a strong link between sleep, poor sleep, and disruption of the gut microbiome, which then leads to a few things. This is what happens. The gut microbiomes are essentially the peripheral brain, and as much as 80% of serotonin is actually not made in the brain, but it's made in the gut. That's why I think the ancients knew that somehow before the science became obvious, that we always talked about the gut feeling. I'm going with my gut. And perhaps it's a nod, intuitive nod to knowing that somehow our digestive system and our emotional, brain, mental functioning are tightly linked. And so when the sleep is poor, the garden of our intestinal gut microbiome is overgrown and filled with weeds and bad pathogenic bacteria, more as compared to the good regulatory bacteria that we need. And the systems of neurotransmitters, the hormonal systems, and our immune system are out of whack because of that disruption of the gut microbiome due to poor sleep. There are some reports that even indicate that the poor sleep may increase the pathogenic bacteria and the response to chewing up the mucous membrane within our intestines, leading to more exposure of the bacteria to the bloodstream. And that's known as sometimes some people call it gut, leaky gut. And that induces essentially a state of inflammation throughout the body, low grade inflammation, which then affects our metabolism. So the listeners should really look into not just sleep as it pertains to how they feel the next day, but how it affects their brain, their cardiovascular system, their endocrine system, and how it affects their gut microbiome. And the surprising thing is, these are all interconnected processes. So it starts with keeping it simple and focusing on basic foundational techniques. Margot, like you described, keeping that phone away from the bedstand. That leads to so many downstream positive benefits that the listeners may want to examine what could they do in their life to make a difference to their entire overall health, including mental health.
Well, it's funny you link the gut and the sleep, and I've heard too that sometimes when you're sleep deprived or you didn't get as good of it impacts like what you may be craving. So,
Yeah,
like reaching for that like sugary donut first thing in the morning, you may not have that feeling if you
mm,
got a good night's sleep. You woke up, maybe had water first before you have your coffee.
absolutely.
There's a lot of link between what we're putting in our mouths and also the impact. I heard another thing about like, monitoring. I mean, I know we should monitor sugar in general, but I have a sweet tooth. But close to in the evening, I've had people ask me before if I eat sugar at night, do I have an impact sleeping? And now that I've started to think about it, I'm like, you know what? On the nights that I do have dessert or something sweet, I do wake up more. It's not as profound. I hate to admit that, but it seems that the food definitely also links with the sleep.
Certainly. So you bring up food as a part of our culture. Food is not just fuel, right? It's deeply linked with our sense of well being, our sense of identity and culture in many cases. But there are still ways to enjoy food without labeling it, but doing it in such a way that it actually enhances health and well being and not affect our health and sleep poorly. So for the listeners, it could be something as simple as knowing that eating too close to bedtime, whether it's a nice Italian meal or a taco meal, doesn't matter. Eating close to bedtime, especially if it's paired with any kind of alcoholic beverage, is certainly going to disrupt sleep because of acid reflux, because of increased demands of digestion, and the impact of alcohol and drinks on just how our body metabolizes that. So yes, the sleep is going to be disrupted if the food and beverage consumption is closer to bedtime. So yeah, I think that's the key there. Knowing what works for you and making some simple tweaks so that you can still enjoy life as you know it, but without the downside that comes with it.
Yeah, there's definitely, I think, as we all work on our own health and wellness journeys, we learn what works, what doesn't work, and it's definitely not a one size fits all for everybody. But there are things that generally you can start. If someone's listening to this and they're saying, like, okay, so I got to fix my sleep. What are some of your easiest solutions? Like, you have a patient who comes, what are some of the easiest ways that somebody can implement that? Because some people, certain things may not be achievable, but sleep, at some point we're all going to put our head down somewhere and we're going to get a few hours in, hopefully 7 to 8, but maybe not for everyone. What are some attainable, achievable things that people can do to just improve or try to improve?
Certainly. And it's similar to what we talk and teach in management. Sometimes you need to measure what you want to improve. So while I do not recommend being obsessed and fixating on numbers and looking at daily sleep, total sleep time obsessively, that's not the intent. The intent is to live without even thinking about health and well-being. But to get there, it just requires key steps. Discipline, as you know, it is not about just exercising willpower. It's about creating rituals and small steps that build over time. So for the listeners, I would say to know yourself, um, use your phone as your ally in this case. As you start out this journey, understand what your total sleep time is. If you have a smartphone, it'll tell you that. So I would encourage you to look at two specific markers. One is what's your total sleep time, and what second thing is what's your total step count. And there's a strong correlation between mobility, exercising in the daytime, and density and quality of sleep. So I would urge the listeners to focus on the basics, the fundamentals. Make sure that your screen time is less, and make sure your step count is high. Make sure that you are at least getting 7 hours of sleep if you're 18 and over. And the fourth thing I would suggest to know is uh, the scary statistic is in the US, almost 60-70% of population of all of us are either overweight or obese. And that leads to its own set of sleep disorders that all of us should be aware of as a part of public health awareness. So I would urge the listeners to ask themselves what their stop bang questionnaire is. And they don't need to remember this in detail, but at least to know what these 8 questions are. And if they score 3 or more yes to these 8 questions, they should talk to their physician or their clinical provider around checking that out further. So, what are these stop bang questionnaires? S stands for snoring. Do you snore at night or not? Yes, you get 1 point. No, 0. T is tired. Do you feel tired in the daytime? Excessively. O is observed pause in the breathing as reported by the bed partner. If you have that, you get 1 point. P is pressure, blood pressure that requires medication. B, as in Bravo, is body mass index of 30 or more. Are you overweight, obese? If you have that BMI of over 30, you get a point. A is age 50 or higher. As we grow older, muscle tone changes, and that leads to higher risk of sleep apnea. N is neck size of 17 and a half or more in men, 16 and a half or more in women. That's a predictor of sleep apnea as well. And G is gender. Male, you get 1 point automatically. You're kind of at a loss here. So with simple stop bang questionnaire, if someone scores 3 or more out of possible 8, they are considered to be at risk for having sleep apnea, and they should talk to the doctor about this and get it checked out. Sleep apnea, insomnia are strongly linked with many mental health disorders, and treatment of sleep can help improve mental health conditions, substance use, and actually help us overcome and live a more resilient life while we kind of overcome the mental health challenge. So these are some basic steps that I would recommend our listeners to do their own study on and ask questions further of their sleep and healthcare providers.
I'm glad you said it because we always say like there's never just like one magic bullet, right? And you kind of said it without saying it when you mentioned the food we eat, the steps we take. It's kind of like food, sleep, and movement. It's like almost, like the triangle, the trinity of what you're striving for. Because you mentioned inadvertently, when your sleep is not as good, you're not moving as much, and maybe your choices for what you're eating are not as great or not, fueling yourself. So it seems like really there's no just one.
Correct. It's interconnected, and certainly if you look at our metabolic crisis that the entire nation, perhaps entire world, is facing, it's linked with all these foundational factors, and they're tightly linked with menu, mind, move as the 3 pillars. What we consume affects our body and our brain. How we move or not move impacts our systems and brain. And then finally, the simple act of how mindful or not mindful we are in our life, work, play affects how we function as an individual, both physically and emotionally. So yes, they're absolutely tightly linked. Sleep is foundational. Nurture sleep as much as you nurture life, and invest in it so that it can give you more dividends in the daytime while you're awake and allow members and listeners to perform at their best.
It also sounds like, so somebody might be listening to this and your initial focus might be like, okay, well, I need to get the phone out of my bedroom, or, I need to not watch TV before I go to sleep, or all these kind of things. But it could also be that some of those other decisions you're making, like, well, today I'm going to try to go for a walk after dinner. And then that may be what ends up helping your sleep. It might not even be something sleep related, traditionally like making a room colder or things like that. You're doing something entirely different, or what breakfast you choose to have, what time you choose to have your dinner. And then that ends up impacting your sleep. So it might not even be something that's stereotypical, just sleep that
Yes,
then improves the sleep.
absolutely. And it certainly starts with, more self-reflection of listeners looking at their own lives, their own daytime and their nighttime. If they happen to be a third shift worker, things are flipped for them. And there's a whole different category called circadian rhythm sleep disorders, which includes, people who are on rotating shifts, firefighters, policemen, doctors, nurses, people who work in the 24/7 lifestyle industry, including perhaps some casinos, right? So any kind of non-traditional shift work, when it is not a structured time across the entire week and month, has its own challenges around circadian rhythm shifting. People who have traveled overseas know this. When you if you travel to India visiting home like I do, the first 2 days are tough, and that's the circadian rhythm disorder known as jet lag. And it matters because you can't function properly, right? So yes, I think the entire range of sleep disorder needs to be looked at by the individual individually as to figuring out what their sleep duration is on an average. They need to figure out what their sleep onset is. Do they have trouble falling asleep or staying asleep? Is it impacting them in the daytime or not? because not everything needs to be treated or labeled diagnosed. Only if it is affecting you does it need to be addressed, right? So the initial function starts with the listeners doing some reflection and learning more about their own sleep behavior and noticing what is out of whack. And then asking the question, does it need to be tweaked? And if so, how may we do it without relying on medications? And that will come down to, essentially um, figuring out what the specific need is, and then finding more non-pharmaceutical approach to helping yourself, either with sleep hygiene or with cognitive behavioral therapy for insomnia, or with a better exercise movement program that consolidates your sleep. Uh, yes, and then when it's necessary, when there's no choice, there are appropriate approved medications for certain sleep disorders as well. But that's a topic for another day.
That's later on down the line. There's definitely things you can try before. So, as we're wrapping up here, I guess, and we've said it many times, even in this episode, there's no one size fits all, but I always just do find that, you can get wisdom, there's wisdom in the room. So I'd be remiss if I didn't ask, what is your your favorite thing to do? I guess, like for me, since I moved the phone out of the bed, I will say that I've started reading before bed now for a couple months. And that has totally changed the game. I like reading more. And I noticed that, after, depends, it could be as little as 15 minutes up to an hour, that then I'm ready to go to bed. That's been my new routine that I've found that really works. What is your favorite thing or, wellness tip or trick that you would give somebody?
Certainly. I think, for me, the morning sunlight exposure, especially walking in sun and getting that sunlight, which is just mild and starting out, is a powerful Zeitgeber. That's a German word. Essentially, it's a light giver. And that morning sunlight exposure combined with gentle exercise, or you could do yoga outside or just walk around your yard, doesn't matter. As long as you're outside getting that morning sunlight, helps really train your melatonin, pineal, pituitary, metabolic axis. So if you do nothing else but be awake and aware to catch the morning sunlight, by default, you'll essentially start going to bed at a decent time where you can do that and not wake up too late. So for me, that morning sunlight exposure allows me to be in nature with my puppy and listening to the birds. So, we all suffer from some degree of nature deficit disorder. And that one habit of being outside in the yard, in the backyard, walking the dog, getting the sunlight helps reset I believe, my, melatonin, pituitary, circadian system so that I'm trained to wake up at that time. I don't use an alarm. I'm up without alarm clock. And that's a simple tool to understand if you have adequate sleep. Are you waking up alarm or do you wake up before the alarm?
And they have those, I guess a whole nother episode, we could do the sunrise alarm clocks. Well, it for people who I used to wake up at 2 o'clock in the morning for work. So, there's no sun at that hour. So you do what you got to do, but that's great. It's kind of I hear sun before screens. That's the tagline, sun before screens.
Love that, Margot.
Well, Dr. Vora, thank you so much. This has certainly been insightful. Hopefully folks got something from it that can help them going forward. And we really appreciate your insight.
Likewise. Thank you so much. We'll keep in touch.
Absolutely. And for anybody who's interested in some more information on this topic, you can check out Dr. Vora's clinical grand round. That'll be happening in just a few months. We'll have all of that posted on our website and on our social media as well. So Dr. Vora, thank you again.
Thank you and have a great day.
Well, we hope you enjoyed this episode of our podcast, Recovery with Root. As always, stay connected with us on social media to learn about when next podcast episodes will drop. You can comment, ask questions, even let us know about future topics that you'd like to see discussed. Until next time, remember, progress is the destination.